Good day to everyone. Welcome back to another coffee break program. Today we are going to discuss about the causes of hair fall and the treatment options for hair fall. It's a common question and common problem all over the world that people face into various type of problems with hair fall, and many people are suffering from hair fall and they don't know exactly what causes this. Before we discuss about the causes, let's see what is a hair shaft. A hair shaft is a dead keratinized particle of the body which is expelled by the hair shaft, hair follicle. These are the three simple stages of hair growth: anagen, catagen, and telogen. In anagen, the hair follicle grows, and in catagen, the blood supply to the hair follicle get cut off, and in telogen, the hair shaft starts falling. This goes in a cycle. Usually, a person undergoes about 50 to 100 hair falls per day. Sometimes you don't notice this because these hair shafts are very tiny hair shafts, and they fall even without your knowledge. And the lifespan of a hair shaft, or the period that a hair shaft grows, is about 2 years to 8 years. And then it goes into a resting period of about 2-3 months, and then it starts falling. This is the natural process. But apart from this, there are so many conditions which leads to hair fall in excess. What are the factors that we need for our hair growth? Usually, a good healthy hair needs vitamin A, B, C, D, E, and minerals like iron, calcium, zinc, and a good quality proteins. In simple words, you need to have a balanced diet to have healthy hair. So if someone has nutritional deficiency, definitely that will lead to hair fall. But if you take excess nutrition or all these vitamins without a nutritional deficiency, it is not an answer for hair fall, and the real reason is to be found and treated. Apart from that, let's see what are the other conditions and other methods of hair fall. You might have seen sometimes, perhaps you might have seen already, that there are persons whose hair is falling from patches and patches of the skull, and in certain areas. This is called alopecia areata. This is alopecia areata. You can see the patchy destruction of hair in certain areas of the scalp. This is an autoimmune condition, and you can treat this condition, and it takes time to heal. The commonest method of hair fall is called androgenetic hair fall. This is the androgenetic baldness or male pattern of hair loss. Initially, the center of the scalp is getting balded and it goes to the sides later on, and ultimately ending up with only a surrounding circle area of hair and central baldness. There are so many stages before it comes to last stage of central baldness and little hair surrounding the scalp. This is genetical and due to the male hormones which act upon the scalp and causes this hair loss. In females, also, you can see this type of hair loss, and it is called female pattern of hair loss. You can see it in the picture now, and it is little bit different from the male pattern, but gross hair loss mostly in the center of the scalp is prominent. And there are some conditions like hypothyroidism, the abnormalities of the thyroid gland, and after a major surgery or after a stressful situation, you may start falling hair. The special feature of this type of hair fall is if you face the stressful situation or if you undergo a surgery or trauma or any blood loss due to trauma, the hair starts falling after about 3 months' time. And there are some psychological situations where you pull your own hair without your knowledge. This is trichotillomania pattern of hair loss. The person itself pulls its own hair due to a psychological condition. This is tinea capitis, a fungal infection which can cause infected scalp, and as a result of that you may get experience hair fall. This can be treated easily with antifungal medications. You have to contact a dermatologist regarding the treatments. This is dandruff, a quite common condition all over the world, which can cause hair fall. And this resembles the scalp psoriasis, but this is not psoriasis, but this is dandruff. This is called traction alopecia. The tight hair styles can cause hair fall as well. And also, if you torture the hair with unnecessary hairstyles and heating and torturing the hair, also can lead to hair fall. And especially in females, you can see after a childbirth, they fall hair. And also, if somebody is deficient in iron, especially the female parties, they tend to fall their hair. So all these conditions ultimately can lead to a bald head or unusual hair fall. So what are the treatment options for this type of hair falls? As I mentioned before, if your doctor diagnoses that you are having any sort of vitamin deficiency, the replacement of your vitamins can reverse this hair fall. But things like this genetic factors and androgenetic baldness, you have to act beforehand. Before you become bald, you have to take actions. So there are so many methods of treating such type of hair fall. The commonest medication that we use all over the world is minoxidil. For men, you can use 5% minoxidil spray or minoxidil cream, minoxidil foam, to stop this androgenetic baldness. But remember one thing, when you start minoxidil, you have to continue it for 3 to 6 months to get its results. Initially, you may feel that the hair is falling more. That is because the weak hair shafts get activated and the old shaft is falling and a new shaft is growing after using this minoxidil cream. And initially you may understand or you may falsely appreciate that your hair is falling more when you use minoxidil, but after about 6 months you will be okay and it will start giving results. For ladies, you can use 3% minoxidil instead of 5% minoxidil. But you have to remember, for this type of hair fall, you have to use this medication for lifelong. If you stop it after about 3 months, again you will experience hair fall. There is another treatment which is commonly used all over the world, that is finasteride. That is used as a tablet form, and it is very helpful and better than minoxidil. But there is a negative point, because very rarely, after about 2%, can experience some sort of sexual abnormalities like impotence or low sexual drive. And in such occasions, we have to reduce the dose and use it in a small dose. But always you have to consult the doctor, and the doctor should prescribe you all these medications. So, other thing that you have to remember is any sort of vitamin applications or protein applications to the scalp would not help you in your hair fall. There are so many products and so many rumors and so many myths that you may be benefited by using external vitamin E, vitamin and blah blah blah, but these things will not actually in practice help you for preventing hair fall. And if you have any sort of abnormal medical condition which leads to hair fall, your doctor should diagnose that and treat it. Suppose that somebody goes into androgenic baldness, and it's difficult to treat with minoxidil or finasteride, still it falls. What are the options for such a person? Yes, there are so many options, and one thing is microneedling. Microneedling, the theory behind that is when you puncture the scalp with very small microneedle, the amount of platelets aggregating around the scalp is more. The platelets itself has a growth factor. So when you aggregate more platelets around the hair shafts which are remaining in the scalp, the platelet derived growth factors activate and stimulate the hair growth. That is the theory behind microneedling. But if you are completely bald, no point of doing microneedling, because you will not get benefited from it at all. The other common method that people use is platelet-rich plasma. This is called PRP therapy in short. Again, the same theory. When you inject your own platelets, what they do is they get your blood sample, separate the platelets and serum, and that concentrated platelet containing serum is injected into the scalp into various places. Again, the theory is the same, because you give a lot of platelets around the hair shafts, and the platelets do have the platelet derived growth factor, and this growth factor stimulates the hair growth. And this has been used for ages now, and that helps. Remember, but again, you have to have remaining hair shafts to get this type of stimulation. If you completely bald, no point of trying these methods. Complete baldness is called alopecia totalis. It's very hard to treat. This is alopecia totalis, complete baldness, very hard to treat. You can see the hairline drawn in white, no hair at all. Suppose that we fail all these methods and still you experience hair fall and you are going to be bald, and already parts of the scalp is bald. The next option is to do hair transplant. Hair transplant has a very good development nowadays. Initially, what they did was they used to cut a piece of scalp from an area where there are so much of hair, especially behind the head, and then used to suture the wound, and the harvested piece of scalp is separated into hair follicles, and those hair follicles separately planted in the bald area. This is done over a long period by doing small holes and just like planting some plants. It takes time. But now there are so many new methods, and they do not harvest the scalp part by cutting a piece of scalp, but what they do is they randomly pick up the hair follicles in the area where there are a lot of hair shafts, and then transplant them in the scalp where the baldness is prominent. And the latest method is a robot is used to harvest the hair follicles from the hair rich areas, and then they are separated and separately manually transplanted in the bald area. This is the picture of a hair transplant robot. You can see the scalp behind the head is prepared for the harvesting of new hair follicles from an area where there are so much of hair follicles. Here you can see the robot is using the laser light for harvesting the hair shafts. Initially this process was done manually, but now they use the robots, and which is very easy. And here is a picture of the robot doing the hair transplant in the front bald area of the scalp. Again, the laser rays are used to identify the areas. You can see the immediate scalp of a hair transplant, and you can see the transplanted hair in the bald area. This takes about 1 year to get succeeded. Here you can see the stages of hair transplant. First picture and second picture the hairline, and third picture immediately after transplanting, and fourth picture, fifth and the final after 1 year. Even after transplant, you have to wait for about 1 year to get the successful hair growth. And you have to use additional methods to support the hair growth as well. But it is very effective. In case of failure of all these options, the last option is to wear a wig, which is not very popular, but that is the last option. Hope you learned something about the hair fall and treatment options, and let's meet again with another coffee break program soon.